Hello everyone, today we will discuss MCQs which are based on the problem. So here the case is a 38-year-old female presented with sudden onset of right-sided facial weakness and drooping of the right side of the mouth. The patient reported difficulty in closing her right eye and noticed a decrease in taste sensation on the anterior two-thirds of the tongue. On examination, the patient had a drooping right angle of the mouth with difficulty in closing the right eye. The forehead wrinkles were spared and the patient had hyperacusis on the right side. The rest of the neurological examination was normal. The patient did not report any recent trauma or infection. MRI of the brain showed a small enhancing lesion in the region of the right internal auditory meatus. So the first question is, what is the most likely diagnosis in this patient? Options are Bell's palsy, Ramsay-Hunt syndrome, acoustic neuroma, or vestibular schwannoma. Here the correct answer is A, Bell's palsy. Now the next question is, which cranial nerve is affected in this patient? Cranial nerve 5th, cranial nerve 7th, cranial nerve 8th, or cranial nerve 9th? The correct answer is B, cranial nerve 7th, which is the facial nerve. The next one is, what is the name of the structure where the lesion is located? Jugular foramen, hypoglossal canal, foramen oval, internal auditory meatus. The correct answer is D, internal auditory meatus. Question number 4. What is the function of the affected cranial nerve except sensation of the face, taste sensation of the anterior two-thirds of the tongue, motor function of the face, and control of the stapedius muscle? Here the correct answer is A, sensation of the face. The next question is, which of the following is not a presenting symptom in patients with an acoustic neuroma? Headache, hearing loss, vertigo, tinnitus. Headache, it is not an common presenting symptom in patients with an acoustic neuroma. Which muscle is responsible for closing the eye? Orbicularis oculi, levator palpebris superioris, frontalis, zygomaticus major. Here, which is responsible for closing the eye? The correct answer is A, orbicularis oculi muscle. What is the name of the condition characterized by loss of taste sensation on the anterior two-thirds of the tongue? Agusia, hypogusia, dysgeusia, anosmia. Here the correct answer is A, agusia. Which branch of the facial nerve is responsible for taste sensation on the anterior two-thirds of the tongue? Chorda tympani, greater petrosal, posterior auricular, and temporal. The correct answer is A, chorda tympani. Which of the following is not a branch of the facial nerve? Buccal, zygomatic, mandibular, cervical. The correct answer is C, mandibular nerve. If it is a marginal mandibular, then it is the branch of facial nerve. Which muscle is responsible for wrinkling the forehead? Orbicularis oculi, levator labii superioris, frontalis, zygomaticus. The correct answer is C, frontalis muscle.